Okay, and welcome. And today we are doing Deliverable 6, which is the comprehensive treatment plan for reproductive disorders. And I actually chose a patient with abnormal uterine bleeding, AUB. She had an ovulatory adolescent, 18. So actually she's an adult, but a young gal here. So she also has some iron deficiency anemia secondary to her menorrhagia. Her prioritized pharmacological plan involved our combined oral contraceptives, or COCs, as our first line, of course. And the idea behind that, of course, is to get her to regulate on a monthly cycle, because she was also, she is having irregular periods. Some are very, very heavy, and then some spotting in between, as she kind of described it, but it almost sounds like that was leading up to her next menstrual cycle. But she had a lot of issues about the amount of blood that she was losing, and also some school issues as well. I should just add that before I carry on. So again, the COCs help reduce that menstrual blood, hopefully by 40 to 50%. And improve the dysmenorrhea and the cycle predictability that I think will help her with school as well. So she's more prepared. She's still in school, even though she's 18, so she's in high school yet. And this is coming from ACOG 2025. Oral iron supplementation, checking her ferritin level. It was a bit low. And of course, we're going to supplement that along with some vitamin C to encourage that absorption. Her hemoglobin was 9.8, so just a little bit on the lower end for a young female. And then for pain, we've got her on NSAIDs, 400 to 600 milligrams, Q6 to 8 hours during her menses to help with the prostaglandin production and decrease bleeding and pain. Hopefully help her with her schooling. And then last but not least, if she absolutely needs it, her tranexamic acid, PRN, 1,300 milligrams 3 times a day for up to 5 days during her period if she's having really heavy bleeding. And again, that's kind of a last resort. And we did go through thrombolytic precautions, thrombosis precautions with her as well. She seems to understand those pretty well. And then also non-pharmacologically, we talked to her about AUB and kind of what to expect with the COCs, her side effects, what to report back to us. We did talk a little bit about, of course, using another form of protection. She is sexually active during that first month especially. And then, of course, for STD prevention, because there was an issue there as well. We did some nutritional consulting with her and working on increasing her iron-rich foods. Red meat's a big one. She really doesn't have a lot of monetary access, so she's not really eating healthy. So we did go over legumes and, dried beans and so forth, and then dark leafy vegetables. She does like spinach, so hopefully she'll be able to incorporate that into her meal planning to help for the prevention of long-term anemia. And then because she's a younger gal, we're going to have her use an app on her phone to track her menstrual cycles and note the length, the bleeding severity, signs and symptoms, and then reevaluate that when she comes back. Hopefully she'll be back in 6 to 8 weeks. She's got an appointment, so hopefully she has some compliancy and comes back with some data there. And then symptom management to heating pads with dysmenorrhea, and then hydration and rest during menses. And then lastly, she did need a school accommodations form for her dysmenorrhea impact on her life, especially with PE. She's very insecure about attending that with her period because of the heavy amount of bleeding. So again, we're just focusing on some of those things, and then Also, just making sure that we have some mental health screening because of the anxiety of school stress underlining with the condition as well. Okay, that's it. Thank you.